Good morning, everybody. Today I'm gonna be taking you guys to work with me, kind of give you guys an insight of what nurse practitioners do. A lot of people don't even know what a nurse practitioner is, so I will give you guys an idea of how my day is. I figured this would be a good day to film this because I have my admin time in the morning, so I'm only working in the afternoon, and then I'll kind of tell you what I do on a daily basis. So stay tuned. Oh my god, surprise, surprise, I have no gas again. So I'm gonna go get gas and then go to the post office, and then I'm gonna head to work. I'm actually really early today because I'm 30-40 minutes early to work because I kind of want to run some errands before. So yeah. Okay, so I actually lied. I'm gonna go straight to work because I'm a procrastinator and I'll get gas later. So this is my office, or our office. I share the room with 2 other providers. I'll show you guys my desk. So here is my desk. I have a lot of books on this side that I bought before I started working as a nurse practitioner because I like the feel of books. Although I use a lot of online resources. I have my review course here that helped me a lot when I was taking my certification for A and P. It's by Emily Hollier. It was actually recommended by my preceptor, and yeah, I really like it. It comes with CDs and audios. I have step up medicine, and then I have this spray, bye odor, because I don't like funky smells in the office. And this one is a pocket book given to me by my sister. It's really good, but I don't use it as much anymore. I recommend it for new nurse practitioners. Have my coffee, have some forms that I need to kind of go over with later, and then I have my ID, my phone, sanitizer, my computer, and then this is my bulletin board with my inbox on the side. And yeah, so that's where they put forms that I need to finish, and that's pretty much my desk. This is where I stay 5 days a week. And then my coworker put up this blue lights in our room to kind of make it more lively. And yeah, look at the boards. Mine's the plainest one. So this is what I usually wear for my work. Yep, I wear scrubs because I'm a lazy person. I usually don't like to dress up. I like to dress up sometimes, but most of the time I'm too lazy. Just wear scrubs and then my white coat. So what I usually do before everything is I just kind of go straight to like turning on my computer because everything is in here, like your medical records and all those other things. So that's what I usually do. The reason why I also decided to go straight to work is because I have a lot of items in my inbox and PAQs that I need to go over. So what those are pretty much things that I should be doing for my admin time, the one that I mentioned a while ago. So admin time is a very generous time offered by companies to providers to kind of go over, you know, like the lab results, medication refills, medical questions that your patient has. And most of those things are things that you can't really do on a work day just because you are stuck seeing patients the whole day that you can go over everything. They give us, every day they give us like an hour of admin time to go over them, but I choose to do with them all in one day, so I'm off most of the time on Mondays. Logging back in. I wonder how much stuff I have on my inbox because I didn't go over them the whole weekend. So Mondays are usually hard for me because my inbox gets pretty filled up. So right now it is 12:26. My first patient in the afternoon usually comes in at 1:15. So I have some time, you know, to kind of do all the things that I need to do. I have my computer on right now. And I'm not gonna show this because of the HIPAA violation and all that stuff. I don't want to get in trouble, you know what I mean. Let's see how many things I have to go over because I'm pretty good with going over my inbox and my PAQ. So PAQ is pretty much where I get lab results from like lab companies for my patients that I have to review, or if I consulted another specialty and then they've seen the patient, they send me like notes and they're all in my PAQ. So it's like provider approval queue. And then I have 28 tasks in my inbox. It's quite a lot. I actually don't like having inbox more than 10 every day. And then my PAQ right now is 20. Oh my gosh. Probably gonna be working a little longer today than usual. I have 12 appointments for the afternoon. And I'm double booked, which is not bad. I'm double booked at 1:15. And that's about it. Tuesdays are usually like my busy days. Tuesdays is when I get my full schedules. I usually see like I have 24 to 26 patients in my schedule every Tuesday. So yeah, I'm not looking forward to Tuesday. So I'm just gonna go over my PAQs for like a few minutes, and then I will show you guys. I'm pretty sure you guys have seen what physical exam room looks like. If you've been to the doctor, then you'd know what it looks like, but I'll show you just for like learning purposes. So yeah. So this is what the exam room looks like in America, because I know it's different in other countries. There's a trash can, sink, some soap, and then the exam table where there's a bunch of writings. I don't even know who put that. And then there's the ophthalmoscope and the otoscope for the eyes and the ears. There's a computer in here, and then this is where I usually like sit. I like sitting and talking to my patients. Patients usually over there, but I made them sit over here. And then I kind of just chart away. I try as much as possible not to chart and do my history at the same time, but it's kind of hard because you don't really have time. But yeah, there it is. Saw my last patient for today, but I haven't really finished my charting, so I might stay here until 5. Some days it's bad where I have to stay until 6, but yeah, it all depends on how busy we are. But yeah, I'll see you guys in a bit and I'll update you when I get home. Okay, so I am home now, but yeah, that's pretty much my day in the clinic today. Of course, it's not gonna be how it is every single day because working, of course, in a customer service job means like it's almost like a surprise. Going to work, like there are days you get nice patients, there are days you get really rude patients. It's different every single day, and there are days when it's like smooth, and there are days when we're so behind. So yeah, so what is a nurse practitioner? And I think I've kind of mentioned it and put like a little subtitle in the bottom in my other video, Provider Burnout, which you guys can also check out. Nurse practitioners are pretty much kind of like doctors or physician assistants. We're kind of like all in the same category. We're called in general a provider because we provide healthcare. We pretty much treat patients who come in our clinic that are sick but not too sick, or if they're too sick we send them to the ER. We also refer them to specialists. We also make sure that they follow healthcare maintenance when they do their screenings, like breast cancer screenings, pap smears. We provide birth controls, we provide steroid injections, so a lot of things. And it's a big you know, like learning experience, because especially in primary care, because I work in primary care and I feel that it's very broad. There's so many things under it. We're under this very big umbrella. So in order to be a nurse practitioner, you have to be a registered nurse. So you have to go through nursing school, then be a nurse for a few years, and then you go back to school to get your master's degree and for like 2-3 years, and then you sit for a certification, sit for your license, that kind of stuff. And so if you want to become one and you have any questions, just leave a comment below. I'll be happy to answer them. So yeah, I'll see you guys in the next video. I'll provide more insights about this career, and yeah, I'll see you guys. Bye.